All right. Hi, this is State Representative Todd Stephens. I am here with Patty Barella, who is a Horsham resident and a nurse who has been on the front lines dealing with COVID patients. And I thought it would be great to hear from her in terms of, her day-to-day life, what she has experienced, and give us some perspective on what's going on in our hospitals from a nurse's point of view. So, Patty, thanks so much for sharing your information with us today.
Thank you.
And so, let's just jump right into it. Could you just kind of describe how your role has evolved as a nurse throughout this experience here with COVID-19?
Yeah, so my role at Abington, I'm the heart failure coordinator, typically on my regular job. Since COVID has started, our heart failure unit has become a COVID unit. And in support of all of the nurses there, my role changed more back to a bedside nurse. It's because it's all hands on deck. It's the days are very long and they're very busy and they're very emotional. And it's basically, we need everybody every day working at 100%. And that's not just nurses, it's physicians and X-ray and EKG and lab techs, and everybody is giving 120%. I know it's emotionally draining. It's a very, being in healthcare is emotional many days, and you deal with that because it's tempered with good things and bad things. So you can deal with the bad things because there's always going to be good things that you're dealing with every day. I think the experience now is we don't see as many good things. And don't get me wrong, there are good things that happen, but we don't see as much of that. And a lot of it is just sad. And it changes your very physical work, because it's turned into very physical work. You put on your PPE. The patients are so sick. And it also has that emotional edge to it that you just can't shake it. And it doesn't leave when you go home at the end of the day, because then you have this all day long, this feeling of your family and the concern that you have for your family and what you're bringing home to them. I know nurses and physicians that haven't seen their kids because they need childcare with their parents, and they don't want to expose their parents to their kids if they should give something to their kids. So this has been, I can't imagine having a young kid and being 6 weeks without seeing them. And that's what it's been like for many of these people. It's real. I think the scary part is when I see people who think that this is made up, or think that it's not as big of a deal as it's being made out to be. I can tell you that it's a very, very big deal. And it's really scary to watch people go from talking to you 1 minute to needing to be intubated the next, because they answered the phone, or they did something that for you and I would seem inconsequential, but it just put them over the edge of their disease. The other, I think, stressful part for us as healthcare workers is we're used to science. We're used to knowing how to make people better. We're used to knowing a treatment that works or doesn't work, and we don't have that right now. Amazing science has been done, and we're learning more every day, but we don't know what we don't know. And it's a very helpless feeling that you want to help people, and you sometimes feel like you're just sitting, watching, waiting for something bad to happen. So it's just not what we're used to doing. Like I said, we're used to helping. And I said it's brought us together as a healthcare team. We're very much, we work so much better together that even now than we did 6 weeks ago. There's no territorialism. We're definitely all in this together, and we're determined to beat it along with everybody else who's working so hard to beat it. But there's that part of it I feel like has been a lot better. But the days are hard. Coming home is one of the most stressful things that I do, because I ended up becoming positive with COVID. I got sick very quickly. I was working late. I knew something wasn't right. I left, came home. I knew as I was walking into my house that I was going to bring this into the house. And it's another feeling of just, because of everything that happened, that is what I didn't want to do. And now my family, all 4 of them that live here with me, are all sick. And the guilt that goes along with that, and knowing that I brought that home to them, is something that is really difficult. It's really difficult for me. It doesn't sit right with me. I want to take care of my family. And when they were first getting sick, I was too sick to even take care of them. And now at least I can do that part. But now today I have to go back to work tomorrow. So it's leaving them when they're still not better. There's so many facets to this. Being the family, not only for my family, but being the family for many of our patients that are in the hospital, because their families can't be there. And many times it's dying and holding hands. There's so many nurses who would say, I'm going to be in here. I think he's just about ready. I'm going to stay in here and hold his hand for a little bit. We don't do that normally. That's not, and nobody even responds to that anymore, because it's just our normal place. It's like, okay, if you need help or you need me to come in, just let me know, because it's all the things that weren't common are becoming much more common now. And I get emotional because it is emotional, and I don't mean to do that, but there's so much of this that's so emotional. And it's not anything, I've been doing this a long time, and it's not anything like I've experienced. And I worry about our young nurses and our young physicians, because this is their first exposure, and I don't want to lose them, because I don't want them to think that this is what it is either. And the other thing that I worry about is we have these whole set of patients that we're not seeing right now, that we were taking care of, and I don't know where they are, and we don't know if they're as healthy as they need to be, or are they just getting sick and afraid to come into the hospital. So there's so many facets of this and so many layers.
Well,
and it's,
look, I really appreciate you sharing this with us, and I certainly understand how emotionally draining this can be. First of all, I'm glad you're doing well, and it sounds like your family is doing well in terms of their health and are on the mend. So that's really important. Could you describe, I know you were just saying earlier, what lengths did you go to try to keep your own family safe? I mean, it sounds, we were talking, you did a lot.
Yeah, so we were all doing that, but I would come home, I covered my car in plastic so that I could wipe it down. I would wipe it all with disinfectant before I got out. I would take my shoes off. They would never come near the house, because that was something that wasn't covered at work. I would literally take all my clothes off in the garage, come in, go right to the shower. I would not go anywhere near my family until all that was done. And I didn't really see them much anyway, because the days were so long. Like I would leave before they woke up, and I would get home at like 9, 10 o'clock at night, take a shower and go to bed. So I really felt, and I said to you earlier, I never, ever, ever thought that I would get sick and bring it home that way. I was more worried about having it on me. We started to wear hair, head covering things. And so pretty much everything was covered, and everything that I had on, I would take off. But I never thought that I would get sick and bring it home that way. And unfortunately, that's what happened. And I don't know why I never thought that. I don't know why I never thought that I could potentially get this virus, but that's eventually what happened. And that's how I brought it home to them. Yeah. And I thought that they were going to be okay, even when I got sick. Because when I got sick, I went upstairs into our bedroom with my own bathroom. I didn't come out. And I thought, I'm going to keep them safe this way. And then last week, all 4 of them started with fevers. And that out of everything, that just crushed me, because that, like I said, there's so much guilt with the fact that they have this because of me. They've been doing everything right here. They've been staying home. They've been doing everything right. So the only reason that they have it is because of me. And like you said, thankfully, the scary part when somebody gets this is, are they going to be because you don't know, are they going to be in the okay part, like your symptoms aren't too bad, or are they going to be in the really sick part? And you just don't know that. So I feel better now, because they've all had their symptoms for a couple of days, that they're going to be in the less severe part. And I thank God for that. But it still is something that I watch them going through, and it's heartbreaking.
Yeah. You'd mentioned the hours. Prior to the COVID crisis coming to Abington and the community here, what were your shifts like? I mean, how long were your shifts? And
So I work, because of the role that I had, I generally work like 8 to 5. it's, you know, a very typical work week. So that's generally what I do.
And now through this, you said you're working 12, 13, you know.
Oh yeah, easy. I mean, there was a day that I went in at 8 a.m. and didn't come home till like 3:30 a.m.
Now, is that because of the volume of patients? I mean, or is it because you're losing, is that because of the volume of patients, or?
It was because of the volume, and it was because these patients are so much more, they demand so much more because it's such an isolating situation. So our normal amount of staff doesn't cover what we needed to cover these patients. And then as our critical care units started to fill up, they started to retrain some of the nurses who worked on our heart failure unit to work in the critical care areas. So little by little, the team that I typically work with was just losing staff. And the patients that they were dealing with were very sick, like on 100% oxygen. We started to do what we call proning them before they were on the ventilator. So they were very, these patients were all very sick. And we got to the point where the only time that you would go to critical care is to go onto a ventilator. And that was happening on our unit. That was happening sometimes 2-3 times a day that a patient would get intubated and go on a ventilator, despite everything that people were trying to do to make that not happen.
Right.
So
you also mentioned earlier, just in terms of the units themselves evolving. I think you were saying that other units were becoming, they were adapting units for different purposes. Could you go into that a little bit about what was happening over there?
So our unit is the heart failure unit, and it's a telemetry unit, which means they have heart monitoring remotely. And when this all started, and I told you it feels like 60 years ago, but it was not that long ago, they started to use our unit because we were all negative pressure rooms. And at the time, the feeling was that you needed a negative pressure room. Our unit started with like 5 or 6 patients. And at the time, the testing was taking a long time. So patients, we wouldn't discharge them until they were negative or better. Their symptoms were better. And then little by little, it became, there was 20, we have 28 bed unit, and little by little is full. And then we opened up 4 other units that were non-critical care COVID units. And it just kept, and we were closing med-surg units because, like I said, that's the concern for the patients that aren't coming to the hospital now.
Right. So you're repurposing those units to use as COVID.
Exactly. Yes. Like
now,
our surgical unit became a COVID unit as well because our elective surgeries were canceled.
Now, how long has it been? I know you said you're going back to work tomorrow. How long have you been out due to your own illness?
I've been out since the 16th of April.
Okay. So, it's, I guess, a little better than 10 days here.
Yeah.
So you'll be, I guess you'll find out tomorrow what the evolution has looked like, now.
Yeah, it sounds like I've been in touch with people from work a lot, and it sounds like things are getting a little bit better. It's like I said, I think we know more now too. I think we know we have some things that we can do and things that we do differently. And they started a clinical trial with plasma of recovered patients, which is, from what I heard, was they're bombarded with volunteers. Too many to handle, actually, which is really nice.
Yeah.
So I feel like we're on, I think, and here's the other thing I want to say. When this all started, we were seeing young patients. Now we're seeing older patients. Not that that's okay, but I feel like the reason that's happening is because all the social distancing and everything that people started to do worked. And those patients, those 30 to 60-year-olds aren't coming in as much because I think they're at home doing what they need to do. And I know how hard that is. And I've learned how hard that is because being home, now that I'm feeling better, it is a long day. It's a hard day. I didn't quite get that because I was going out to work every day. But I have to say that's working because we're not seeing as many young people now as we did it early on in this. And that's since we've been doing all this social distancing. It does work. And if I can give one message, that's what I would want to say. That worked. And if we can keep that up just for a little bit longer, I feel like things can get back to some sense of whatever the new normal is going to be. And I just think that's so important. And I give my husband and I are both working, so I don't know what it's like to not have a paycheck, and my heart breaks for those people. But this is real. Like, people are dying, and we've got to do this thoughtfully, and we've got to give all of you in government time to make these decisions and do them to the best of your ability with all the data that you're looking at every day.
Sure. Well, I appreciate that. One of the things I want to talk to you, and government's role is, I think, really important here. You mentioned the protective gear that you've had. Could you talk about how that's being used? I know personally, I've spent a lot of time responding to hospitals, to long-term care facilities, to ambulance facilities, looking for gloves, gowns, masks, you name it. How have things been for you on the front lines? What have you seen?
So, I give Abington a lot of credit. I think that they're trying to keep up with CDC guidelines and do the right thing as best they can. But before 6 weeks ago, we would never use the same mask that we're using for an airborne room in another patient's room, or even a droplet room from one room to the next. And we have to do that because we have to preserve all of this. And they're being as safe as they can to keep patient safety and employee safety in mind. But it is very, very different. We have a brown bag. We get a mask every week, an N95 mask. There was a period of time that we only were using N95 masks in critical care for patients that were intubated or had an aerosolizing procedure. Now we're using N95 masks for anybody who's COVID pending or positive, which I think was which I felt much more comfortable with. But there's not an unlimited supply. And hopefully, if this can go on the downtrend now, because everybody's doing all the things that they've been asked to do, we're going to be able to preserve that and use it safely so that healthcare workers and frontline workers, grocery store, all those people don't get sick. So, but there is a limited supply. I think the biggest thing that we saw limited was our wipes, our disinfectant wipes that we use. We call them gray tops. That would be the thing that would run out so quickly too. So it's not just masks and gowns, and it's those kinds of things, and just trying to keep up with all that. And I'm sure every hospital was feeling the same way. I don't know the volume that other hospitals had, if they had the same as Abington, but there's a lot of patients that were dealing with this horrible virus that we all hate. I mean, we all talk about it like it's a real person that you just want to, but it's, we have to protect the PPE as well, but we have to do it safely, and we have to protect the people on the front lines. Yeah. And follow CDC guidelines and all those things. And hopefully the CDC knows what they're saying, because we think that all the time too. Like, they're doing the best they can, but they don't know what they don't know.
I think you mentioned one morning you got a directive about not using a certain medication, and then by the end of the day that had changed, and they told you.
Yeah, so that was ibuprofen, because these fevers are so high and so uncomfortable. So there was a point where it was, okay, let's not use ibuprofen at all. And then by the end of the day, it was, okay, forget it. We're going to go ahead and use ibuprofen. It's just not it's not how we think or how we do things in medicine. When we do things in medicine, it's tried and true, and we know that it's not going to hurt anybody for the most part. We're really sure with a lot of clinical trial and a lot of which is frustrating for people with this vaccine, right? Because everybody's like, let's just make a vaccine. And there's such a process to it to make sure that you don't hurt people. And right. So we're much more used to having a lot of science to help make people better. And this is a virus. Viruses are really difficult, and we're dealing with something that's a respiratory virus. It's the worst possible situation. And I think that if people understand that's why this is so scary. It's not like, even people talk about HIV. Once we learned how that was transmitted, it was very controlled. You can control that. This is respiratory, so you can't control that easily. And that's why it's such a bigger deal. And it has to be so much more of a thoughtful process to keep people safe in how we do that.
So along those lines, the next frontier seems to be testing. And I've had some conversations actually with the president of Jefferson Health just the other day about the need for more testing for healthcare workers, especially because now, as you said, we know so much more. We know that asymptomatic people are transmitting this disease to others. And I know there's a big fear that our healthcare workers are going to work feeling fine, but
Yeah.
unfortunately, carrying this disease with them and transmitting it to others. How was the testing availability that you saw? I mean, were there any issues there?
So I don't think that we're doing my personal feeling, and again, with my limited knowledge of this virus, is that we have to test a lot more people. I think that we have to, for healthcare workers, I think that there should be routine testing, because like you said, I also think antibody testing is going to be important for healthcare workers, because I think some of them have probably been exposed, like you said, and asymptomatic, but then you worry about because at work we wear masks and we try to protect our patients and each other from that. But at home, you're not always wearing a mask in your house. You're not always wearing a mask, people, you're taking a walk or whatever, and you're not always wearing a mask. So I think there have probably been some exposures that people didn't realize. And we have to even have more community testing available. I think if it wasn't for me having this exposure at work, I don't know that my family would have been tested. And I hear that over and over again, just pretend that you have it. There's a difference in pretending that you have it and getting that test and knowing that you have it. Testing, I think, is going to be so important.
Yeah. So how have you, you laid out the stress of all this. I mean, just personally, how have you been able to cope with all that? I mean, dealing with your patients who are, unfortunately dying alone, and holding people's hands, so that you can be the family member, pseudo family member for these folks, dealing with the issues at home, knowing that, you've gone through all that, you've been through a lot. So what do you do to manage all that? How do you cope?
I felt it today, just going back into that, which I didn't think about, like walking back into the hospital today. I sort of felt like that I was feeling every day that I was walking in. I think unfortunately or fortunately, being away from it for a little bit was helpful for me, but not everybody had an opportunity to be away from it. And most of my colleagues have been doing this every day for the last 6 weeks. So, I think the community support that we get helps so much, with just the thank you signs, and, you go into work and there'd be like, the chalk on the sidewalk chalk, and just signs and notes, and that helps. And my friends in this Horsham community, especially since we've been sick, I don't know what I would have done without that kind of support. So that makes it so worthwhile. This whole entire town, I feel like, has the teachers at Simmons, the people. My kids are in college. They haven't been to Simmons in a really long time. People have been amazing, and that has helped us so much. There was actually like a little healthcare parade that went by one day when I was sick. It's like a Horsham Happer community group of people that just go to say thank you to healthcare workers in a little car parade. Probably, if I had to say what helps, it's that kind of support from our community. And I think what also helps is seeing that we had a nurse who, I hope she doesn't mind that I'm saying this, but she was one of our first patients intubated in the hospital, and she was one of our nurses. And we were all I didn't know her personally, but we were all like in her corner. She ended up going home, getting extubated. She was actually the first patient that was extubated at Abington, and going home. And that is, if you could have seen the line of people that came, it was like a quick, she's going home, let's give her some support.
Right.
I think the whole hospital was there as she walked out the door, clapping and cheering. And so those kinds of things, and seeing her go home, I guess if I had to say what gets you through it, it's all that. Yeah. And I think looking at all the people that are staying home, because I know that's hard, and I know people don't want to do that. And I think that helps you get through it too.
Yeah.
It makes me really upset though. And I don't take away, people can definitely protest and do all the things that they need to do, but seeing people out without masks and yelling and screaming and saying that this is all a joke and a farce and made up and not true, I think that is devastating. It is. Yeah. But I think more people are in the other group of the people who are just supportive and trying so hard to do what they can do to slow this virus down. Right. And then my last community thing is, I think flu shots in the fall should be everywhere. on the street corners. Like everybody should, honestly, if we can get that under control, it's going to make it so much easier because we're going to see this again, right?
Right.
We don't want to see both things together. And I think flu shots should be almost mandatory and everywhere. If we're back in school, they should be in the schools. Nobody should have to go through a process to get a flu shot in the fall. That's my other sort of feeling about it.
Well, that's good to know. One of the things I wanted to ask you was, what can we do in government and state government to try to help? That's actually a great idea. I mean, we have made them widely available. Pharmacies and things like that can now provide flu shots. So that's something to think about is, how do we expand the availability so that people.
And I remember with the H1N1 at that, when that was a big epidemic, and we were getting those shots in the schools at that time. And I don't know what school will look like in the fall, but I just think that flu shots, that should be a no-brainer. I mean, I know there's people who can't get them for whatever reason, but I just think that should be a no-brainer. And I think that will help so much as we come back into this in the fall in a bit. And I also think we're going to be so much more prepared then. We have all this plasma from people who have been positive, and we have these amazing scientists. And I do feel like things are going to be better, but we just have a little bit longer that everybody has to wait, is my feeling.
Got it. Well, look, Patty, I really appreciate you spending all this time with me and helping to really pull the curtain back and let people understand, what it's like on the front lines in our hospitals right now for our nurses. So thank you for all that you've done.
And thank you for all you're doing too. We really appreciate you.
Well, I appreciate that very much. But, look, you're on the front lines. You're heading back into work. God bless you, and stay safe, and best to your family as well.
Thank you.
Yeah, we really appreciate it, Patty. Thank you so much.
Thank you, Todd.